So I'd love to welcome Corinne Mills to the PeopleFirst Summit. So Corinne is interim chief exec of the Alzheimer Society. So Alzheimer's is something that I think affects many of us these days. And I didn't realise that dementia is the biggest killer in the UK. I had no idea. And Corinne's going to talk about some amazing work they've been doing. And they were actually the #1 inspiring workplaces. So we're really, really grateful that Corinne was able to join today and talk to us about this amazing piece of work they've been doing at the Alzheimer Society, looking kind of values-based approach to leadership and culture change, and how values really have helped kind of, galvanize the culture change that was required. So, Corinne, thank you so much for joining us today. I'm going to hand over to you. I'm going to shut up now because I've already gone over, and apologies for that. So over to you, Corinne, to share your amazing story with us.
Thank you, Emma, and thank you for that lovely introduction. It really feels like I'm coming in at the right time, just having listened to your presentation, and particularly about the importance of engaging the workforce and really thinking about the future. So I am very excited to be joining you today and to be talking to you about our culture shift. So as Emma said, I'm Corinne Mills, and I'm currently the interim chief exec at Alzheimer's Society. I've been at the Society for 7 years, predominantly as the chief people officer, and more recently, the last 8 months, I've been the interim chief exec. And I'm going to talk you through why culture is so important and how we developed a set of values with our staff, with our volunteers, with people affected by dementia, and really set them in place, properly integrated them, and how they have enabled us to have an absolutely significant impact on people affected by dementia. So I am not able to move my slides at the moment. What is going on with that? There we go. So who are we? Well, as Emma's already said, dementia is the UK's biggest killer. More people die from dementia rather than from any other disease. So not heart disease, not stroke, not cancer. It is dementia that is the UK's biggest killer. And currently, there are just under 1 million people living with dementia in the UK. That is likely to rise to 1.4 million by 2040. And at the moment, 1 in 3 people will develop dementia during their lifetime. So that is a huge number of people. As the Alzheimer's Society, we look after, support, influence about all dementias. Alzheimer's is the most common cause type of dementia, but it is not the only one. There are numerous different types of dementia. But the impact that dementia has on people who are diagnosed, but also their family, their carers, their loved one is absolutely massive. And the annual cost of dementia at the moment is £46 billion. So it has a huge impact on society. So that's everything from the fact that if you have dementia, you are 3 times as likely to go to A&E. If you're in hospital, you are likely to be there and have an extended stay in hospital for 6 weeks longer than somebody with any other illnesses, because it's very hard to discharge people with dementia. In care homes, 70% of people who are in those care homes are there and living with dementia. So those are just some of the stats that show what a massive impact dementia has. And it is one of the things that most people don't know about. 40% of dementias are preventable. Again, a fact that not many people know about. So the work that we do is absolutely critical to raise awareness and to influence for better care, better treatment, and for change. As an organisation, we're a big organisation. We're the biggest dementia charity in the UK, and our turnover is currently £130 million. So a decent size to be able to affect change. We have 1,800 employees, and 4,000 regular volunteers, although we have many other volunteers that might do one-off activities for us, whether that's running a marathon, attending an event, or indeed campaigning for change, to influence and effect that change. As a charity, we are quite unique in what we do, not just in the dementia space, because we not only deliver direct services, so that might be through our helpline, or it might be through face-to-face support and advice to somebody or to their family members who are affected by dementia, or it could be running a memory clinic, a memory cafe, or one of our flagship services such as Singing for the Brain. But we don't just have the patient voice through the services that we deliver. We also fund significant research into better treatment and better care. And because we've got that patient voice, we're able to influence for system change, whether that's with government or whether that's through local leaders, and indeed raise awareness across the public. So we are quite unique in what we do. So our journey, and that's what I'm here to talk to you about, is one that started back in 2018 when we were not in a good place as an organisation. So I joined in 2018, the end of 2018, and then at the beginning of 2019, we were hitting the headlines for all of the wrong reasons. So we were the front page of The Guardian with allegations of our CEO bullying and harassing members of staff. We were also being cited as having paid significant amounts of money to members of staff when they left to prevent them from being able to speak out. So non-disclosure clauses, gagging clauses they were talked about. And indeed, we also had what we described at the time as being a Twitter storm, where we had members of staff, or we think members of staff, who were anonymously posting on Twitter, now X, and criticising the leadership of the organisation, and particularly two members of senior leadership, the then CEO and the then chief exec. So we were not in a good place, and all for the wrong reasons. So this next slide I'm going to show you takes you through the culture journey that we've been on. So you see at the bottom of this slide, that's when I'm talking about the fact that we had allegations of bullying and harassment. We also had significant negative media focus, which impacted on the partnership work that we were doing. It impacted on people who wanted to donate to us, people who wanted to fundraise for us, people who wanted to support us, or people who wanted to get advice from us. How could they trust an organisation that had that sort of headlines? It didn't matter whether or not that was a factual position or not. Our engagement scores were not great, but actually all the work we did to try and identify what was happening meant that it probably was some isolated incidents, but that didn't matter. That was the perception. So we knew that we needed to make significant changes within the organisation to really change the culture and the experience that people had, so that we were a trusted organisation. We were somewhere that employees wanted to work and volunteers wanted to give up their valuable time. So what did we do? A number of different things, including having a new chief exec who joined the organisation and making some changes to the way in which we worked. But critical to that was about our culture and our values. So we developed a new set of values, absolutely co-created with our employees, with our volunteers, and with people living with dementia and their families. And the way in which we went about this was we ran a number of sessions. We had over 1,000 people who participated in the values workshops that we did. And we talked to people about the fact that we wanted to work out what type of organisation we were and that we wanted to be for the future. And we said, if you were describing us as a person, who would that person be? Because we wanted to make sure that we were really true to whatever values that we came up with. And through those particular sessions, a number of names came out very strongly. Michelle Obama came out a lot. David Attenborough came out a lot, and Marcus Rashford came out a lot. And if you think about those individuals and the personality that you think of them, now bear in mind this was back in 2019, running into 2020 that we were doing this work. It is the type of person that you would see as being really trusted, somebody that stands up for what's right, somebody that would go the extra mile to make a difference. And therefore, quite quickly, we came up with the 4 values that you see on the slide now. So the first one, determined to make a difference. We're an organisation that does very tough work. The people that we are supporting day in, day out are going through difficult times. If any of you in the audience have had a loved one who's been affected by dementia, you know what a devastating disease it is. You know how frightening it is for the person who's got dementia, but equally how frightening it is for the people who are trying to support and care for them. And it is the only disease that there is no cure for, and at the moment, and it was even more so at the time that we were doing this work, there were no disease treatments that were in place. We do now have disease-modifying treatments, but they're not yet available on the NHS. So it is something that we need people to feel really determined that they're going to make a difference. So that's people who are passionate, but also people who are who have really strong levels of resilience, and people who are able to be relentless in the pursuit of making improvements. The trusted expert piece is really, really important. Because of the knowledge and the experience and the voices that we're able to bring to the fore, we are a trusted expert, and we needed to build that in our credibility at that particular time. The better together, as an organisation, when we were building these values, we were one that didn't really work across the organisation. We had lots of silos in how people worked, but also we were quite exclusive in our work outside of our own organisation. We didn't work that well with other charities, and we weren't as strong as we needed to be with partnership working. So better together for us is about true collaboration inside the organisation, as well as really strong partnerships with others outside the organisation. And I'll talk a little bit more about that, but it's not just the other dementia charities. It's also charities like British Heart Foundation or charities like Marie Curie, where we've got really strong partnerships and ways of working now. And then the final value, compassionate. You might think, well, of course you're going to be compassionate. You're a charity. It's much more than that. It is about being warm and kind with the services that we provide, but it's also about being really honest and being brave, because we need to challenge government, we need to challenge others, we need to challenge ourselves. And therefore, it is about being brave and stepping out and speaking up for the causes that are so critical. So we also at this point developed a culture statement, because we didn't only want to have a set of values that we were going to implement into recruitment, training, development, and how we talked about ourselves. We wanted to make sure we brought it to life for all of our workforce. So this is the cultural statement that we built during 2020, and again, co-created that with staff and volunteers. We wanted to make sure we were a place where people were trusted to make good choices. One of the things that we found out about our culture was there was lots of looking up, so waiting for senior leaders to make their decisions. And we wanted people to make their decisions and make the choices at the right levels, but also feel confident, because no two decisions are ever the same. So making sure people had a good framework and making sure that we're able to support people in the work that they do. We also wanted to make sure that the culture was engaging, but one where there was a really good strength of diversity, not just diversity in representation, but diversity in thinking as well. So the widest range of people and information. And of course, one where we're continually learning. One of the things that we discovered about ourselves was that we were very good in trying different things. And if they worked, great. If they didn't work, we would just stop them. But we wanted to make sure we were taking the learning of all of that to make sure that we were having a bigger impact for people affected by dementia. So those were two things that were absolutely core to how we were going to make a difference in our culture. The rest of the things that you see on this slide were the other elements, but they were all based around the values that we had. So one of the things that you can see is our fundraising philosophy. So fundraising is something that's critical for every different charity, but it is really important to us that we had a philosophy around it. And that was based on how did you bring through each of those different values to a fundraiser? And what did that mean? So, for instance, the one about being compassionate and making the right decisions was the element around we would never put any of our fundraisers in a position where they felt compromised. So, for instance, some of the big gala dinners where there has been history in the charity sector of particularly young women being taken advantage of. Our staff were not going to be in that position. We were really clear in our fundraising philosophy that we would walk away from income and partnerships if that was the type of environment that somebody might be put in a position of. The piece in here about the associate directors being established, critical for us about that decision-making piece. Previously, we had a top-heavy executive leadership team of 10 directors, and then the next tier with 60 heads of function across the organisation. We changed that. We had and we still have 6 executive directors, and then we have 17 associate directors. So those are the people who run the organisation, really focused on making sure that we are a really effectively run organisation. And then the executive leadership team can be really strategic and really outward facing in thinking about what we need to do, not just for the next 5 years, but for the 10, 20 and 30 years. And that's how far we look ahead now. The other thing that we did that really made a difference in being honest and transparent is we put in place weekly, what we call society briefings. So as we were going through COVID, these were launched online, and we had the opportunity to bring in different speakers and different leaders. But they take place every Monday morning for 3 weeks of every month. They are for 30 minutes, and the last Monday of each month, they're an hour long. We have over 1,000 employees who join these every single week. We keep them going, and that's really important. But they are essential for the staff and volunteers to feel really engaged. So we might talk about business, we might talk about the finances of the organisation, we might talk about successes, we might talk about things that have been a challenge. But every single week those happen. And as I said, we'll bring in external speakers who can talk about their particular area of expertise, and they're really valuable. We also put in place a monthly session that's called Ask ELT Anything. Ask the executive leadership team anything. The exec leadership team turn up. People are able to put questions live into the questions box, and they get voted on. So the questions that get answered are the questions that most people want to hear about. And we answer all of the other questions, and they go onto our intranet. When we started this work, the questions that we got were by people putting in their names as anonymous names. Somebody put in Bo Peep, for instance, at one particular point. And we got questions about why are you taking such a high salary, or you must be ashamed of yourself for the way in which you're leading this organisation. Quite quickly, I would say within 6 months, nobody put in their names anonymously. They put in their true name or their team name. And the questions are still very challenging about strategic decisions, but we're really open and we're really honest about them. And if somebody puts in a challenging question, it's not just the exec team that are answering. Others are being able to answer a question live. So we get a really good dialogue. And that is one of the things that has built the culture about honesty and transparency. So just covering off a couple of the other things that are on this slide. The fact that we have been really open about when mistakes have happened and transparent about why we're changing them. One of the things you see on here is where it says Dementia Connect to DSP transformation. Our Dementia Connect programme was one of the direct services that we were offering at that particular time. And we had a huge amount of feedback from employees, our dementia advisors, that it just wasn't working. We had leadership in the organisation that kept saying, give it time. But actually, we needed to listen to staff. So the new chief exec and I ran a programme with all of the dementia advisors, and then with commissioners, and then with people living with dementia. And we took that feedback and we absolutely transformed the service. And it's used as a really good example of where the senior leadership have listened to staff and said, right, you are the experts. We will make this change. And that has meant that we have absolutely thrived as an organisation and built that trusted expert piece with those people who are commissioning us. We've also put in place some activity that's meant that we have won numerous awards for the well-being of our workforce. Through COVID, we put in place a financial hardship fund. We have given additional half days for people as well-being days. We put in place an app that's enabled people to get any mental health support that they need as soon as they need it. We use Thrive. I know there are many others that are available, but that has been really well received by our workforce. And then you see towards the top of this, we were Sunday Times. So back in 2023 was the first time we entered the Sunday Times Best Places to Work, and we did get accredited and recognised as a Sunday Times Best Place to Work. So there were lots of different activities that we put in place. All of our recruitment, all of our training, all of our development is based around our values. And that has absolutely been instrumental in making sure we can be positive and ensure that we are a workplace that is a great place to work and to volunteer. So at the top of that last slide, I'm showing you the fact that we got to a point of being Sunday Times Best Place to Work, but also we were at the point of needing to rethink our strategy. So we'd had some changes in our board. We were halfway through the strategy, which is usually the time that we would start to do a consultation with people affected by dementia, other partners, other specialist professionals, NHS, government, etc., about what we needed to do with our strategy. But actually, we felt our strategy was working, but we did need to make some changes to the culture of the organisation. We'd gone very heavy in wellbeing and looking after our staff. We got to a point that we had huge ambition in the organisation. We were recruiting from really talented pools. Literally, we would put an advert out for a role, and within a couple of hours, we would have had over 500 applications for almost any particular role. And whereas before we were struggling to get the right talent into the organisation, our initial shortlists were taking us down to at least 50 people who, ticked every single box that we were looking for. So we were recruiting real talent. We were retaining people. Our retention rate had gone from over 25% to getting down to 10, 11, 12%. But we knew that there was more that we needed to do on the culture, in that there was an organisation where people loved working for the organisation, but also had pretty high expectations about what the organisation would deliver from them. So that was partly because of some of the actions that we had deliberately taken, but I'm sure many of you had also seen and have seen the fact that individuals that have entered the workplace since COVID have different expectations of their employer. There's lots more expectation on the employer to deliver for employees. And therefore, we needed to make sure we were setting out very clearly what the organisation would deliver, which was huge in our view, what managers would deliver to support employees and volunteers, but also what our was an expectation that individuals would be expected to do. And that's not just about turn up for work and deliver against your objectives. It's also about take responsibility for asking questions, finding out what was going on, take more responsibility for your career. What job do you want to do next? What skills do you want to develop? Rather than it all being expected to be delivered by the organisation. And that's where we get to with the high expectations and high experience, the accountability bit. We also had much more scrutiny on budgets and on impact. We were starting to get much more data on what was being delivered, which meant that there were some things that we were starting to say, actually, that's not delivering the return on investment. That's not delivering the impact for the amount of money that we put in. And for any of you there that have ever worked for a charity or volunteered for a charity, many people join because they're passionate about the cause. And that means that there might be something that the charity is delivering that has really benefited a particular individual, family member, or person that's been affected by, in our case, dementia. But sometimes we're needing to say, actually, that's not having the impact. We're going to stop that. And therefore, the levels of engagement that we need with our workforce to be able to demonstrate we're not going to do that, but this is how we're making an impact. We've absolutely got to take our workforce with us to be able to do that. So that was one of the reasons why we needed to dial up the culture on what we call compassionate leadership or wise compassion, which is about really strengthening our performance management culture, so that people are clear what's expected and that we are taking action to make sure we're supporting people to improve their performance. Some of the other things that you'll see on here are about having a speak up community comms, enabling people to really be able to share any of the experiences. So we felt like we were in a strong position we've got a very strong employee forum. We don't have unions, but we have elected representatives that form our employee forum, and they are involved in lots of what we do, including strategy, including engagement surveys, including changes in policy and practice. And we have a similar forum for our volunteers. But we wanted to make sure that although we always talk about how people are able to share their voice, be involved in different things, if there was an issue in any particular area, that people would have a route to be able to raise it. We didn't want anybody to be sat in a particular role where they might have concerns about their manager. They might not feel that they've got another route to raise any of those concerns. And particularly important for us when we are an 80% either home-based or community-based organisation. So people come together a lot, but we don't have that many offices for people to come in on a regular basis. We're not an office-based organisation. So we have recently launched our Speak Up community platform, which means that people can anonymously raise anything that they want to. And we have an opportunity to think about what people are saying, and an opportunity to respond to that individual and ask them to share more, all anonymously if the person doesn't want to erase that. What we've been really pleased with is, although that has been in place for a few months now, the number of people that have come through that has been very, very small. So I think we've had 10 comments that have come through over almost a 6-month period. And 8 out of those 10 have been people saying they just wanted to say that they think it's great that we've got this. A couple have been followed up and have enabled us to really be able to support some changes that individuals have wanted. But it's great that we've been able to have that platform. We've also done a lot on leadership capability. We've run women in leadership programs because 80% of our workforce are female, but we didn't have as many people applying for promotion opportunities. So really having a great opportunity to support, develop leadership. And we have that at lots of different levels in the organisation. And we've also really promoted secondments in the organisation. So we're a very ambitious organisation, and We attract very ambitious people, but we also need to make sure that we make a huge difference in what we do. So this slide just brings those two previous slides together and shows, hopefully, that we have gone from strength to strength in the organisation. Just some particular stats that back this up for you. We've had the opportunity to make sure that we've tracked the impact of the work that we have done as an organisation. I'm bringing out a few of these. In 2024, we were again Sunday Times Best Place to Work, which is brilliant. We've won numerous awards for the work that we have done. But one stat in particular, confidence in leadership, going back to 2020, when we had all of those issues in the organisation. At that point, it was down at 47%. Now, our confidence in leadership has gone up almost 30 points to 82%. Our engagement surveys generally get over 80% of the workforce completing them, and areas such as pride in the organisation, recommending us as a place to work, are always over 80%, often touching 90%. So really strong impact in the engagement levels. But it's more about just what our staff say, because we could be a lovely charity, we could be a great place to work, people could love being part of it or volunteering for us. But actually, it's about the impact we have for people affected by dementia. So this slide shows the progress that we've had through our strong culture and values-led behaviours. So one of them is about the income that we have as an organisation. So most organisations, and indeed most charities, would love to be in single digit, let alone double digit growth. We have since that period had double digit growth year on year. Each year we are breaking our records on how much income we're bringing through fundraising. And last year we had a 17% growth in our fundraised income, which is amazing. We've gone from an 80 million organisation to £130 million turnover, and we're aiming to get to £200 million turnover. And all of that money goes back into making sure services or research makes a huge impact for people affected by dementia. We also, in the services that we provide, we've grown the coverage and therefore the direct support that we deliver. And now we cover 90% of England, Northern Ireland and Wales. We don't operate in Scotland. We have a sister charity there. That means the NHS or local authorities, ICBs, are commissioning us to deliver those services in 90% of the UK. And we have a digital service for anybody that doesn't get the service direct. We've done a huge amount on our brand, making sure that we're able to raise awareness of everything from 1 in 3 people in their lifetime will be affected by dementia. And for the first time ever, last year, we hit the top 10 of the EU government brands on charity recognition ratings, which is incredibly important. But we're not just providing those direct services, we're innovating for the future. We've been heavily involved in the disease-modifying drugs, which means that we are able to see the impact of those drugs slowing down dementia, or indeed getting to them to a point where they will stop. We're not able to deliver that on the NHS at the moment, but there are 120 different trials of drugs going through at the moment for Alzheimer's disease, which obviously is brilliant. Innovation as well. We're working with a number of partners up in Manchester about setting up the Manchester Brain Health Centre, which is really innovative, working with universities and health service, and indeed with the mayor and the system set up in Manchester, which will be a one-stop shop for people affected by dementia. Hugely impactful with the relationships with government. So we've been working with the Health Secretary, and for the first time ever, we've had the 10-year health plan has included dementia, and indeed a modern service framework, which will set out the expectations for every single health body and what's going to happen for social care, for diagnosis, treatment and care. That is groundbreaking and will make a huge difference for people affected by dementia. And then finally, a little bit about partnerships. Partnerships are so important for us because it means that we can amplify our voice, amplify the services that we provide. And that's not just being Charity Partner of the Year, which helps us with the opportunity to be able to bring in more money. It's also about awareness raising. And anybody interested in football may have seen our Football Association partnership, which culminated a couple of weeks ago with the England versus Wales men's football team friendly. So this was badged as an Alzheimer Society International. We had coverage across every single different TV channel. It was picked up massively. We had things like, instead of there being children as the mascots, we had people living with dementia who walked out onto the pitch with the England and Wales footballers as their mascots. They were nominated by their local football teams where they are particular fans. What was devastating about it was we got brilliant coverage, but for most of those people who walked out, they couldn't remember that experience the next day. And that is the impact of dementia. So absolutely massive impact for the work that we do. And I finally wanted to end just by showing you our latest video. It's only a couple of minutes. So this is our latest brand advert. I hope that you see those values that I've talked about as we go through this, because it absolutely is being better together. Our latest brand is all about, it will take a society to end the devastation of dementia, not just Alzheimer's Society. So if we could play that video, thank you.
But I was recently diagnosed with dementia.
I'll need help when I can no longer button a shirt or use a knife and fork. I'll need help when I can no longer recognize the faces of the people I love. And we will all need help to develop medicine to end the devastation of dementia.
I can't do this alone.
It will take a society to beat dementia. Alzheimer's Society.
I've got genuinely, I'm not just saying this, I have got a little tear. I've seen those adverts, Corinne, and they are really emotional. For those of us who've been affected by dementia and Alzheimer's, they really hit home. So thank you for that. Thank you for getting me crying on not quite national TV, but emotion is good, right? So thank you. That was an incredibly powerful presentation, and the journey you've been on, it is quite remarkable. I would love to ask you loads of questions. I've got so many questions, so maybe we could do some sort of follow-up. I'm gonna hold you to that, if that's okay. I'm gonna get you.
Yeah, absolutely. And apologies for taking a bit longer.
Right. It's a really powerful story. I know we've got loads of questions, but we haven't got time. So I'm so sorry I'm not able to ask you questions. But thank you for sharing that story. And I think, you know, that the ROI you shared was so powerful in terms of, you know, this really worked. This new approach really worked. And where you went from to where you are today is quite phenomenal. So I have no. It's not surprising that you are number one kind of inspiring workplace. So thank you so much. I'm getting myself together now. I'm good. Thank you, Corinne. Sorry I haven't got time for questions, but thank you so much for your time. And let's keep in touch. And I would love to do a bit of a follow up with you. And I'm sure Matt and the team will do as well, because I'm sure with loads of questions about, you know, the ins and outs. So thank you for your time. Enjoy the rest of the day.
Thank you. Pleasure. Thanks. Bye-bye.